alpha-1 antitrypsin deficiency is a genetic disorder which is defined as having low levels of alpha-1 antitrypsin. Alpha-1 antitrypsin is a protein which is dedicated to counterbalance the effect of proteinases in the body. If we don't have this counterbalance, it is easy to understand that the proteinase will be free to start little by little destroying the different elastases in the body, specifically in the lung. So for those patients having low levels of alpha-1 antitrypsin or having a defective functioning of this enzyme, these patients start to develop the deterioration of the lung and start to develop some kind of COPD associated to this deficiency.
Alpha-1 antitrypsin deficiency is a genetic condition that can cause serious health problems, especially in the lungs. The severity of AAT deficiency depends on whether or not the person has one or two copies of the defective gene. Of the common abnormal AAT genotypes, the severest form is homozygous for the Z allele. People with the PiZZ genotype only have 15% of the normal amount of AAT in circulation, making them more likely to develop emphysema at a young age. Alpha-1 antitrypsin deficiency is a serious chronic health problem. Up to 3% of COPD patients in the US have AAT deficiency. Genetic screening is the only definitive diagnostic test for AAT deficiency.
We know that this deficiency contributes to up to 3% of all COPD cases. So although it is a rare disease, we are talking about a very relevant disease.
When they come to you with symptoms of shortness of breath or cough or wheeze, it could easily be asthma or just smoker's COPD, as we call it. It could just be run-of-the-mill emphysema, but it also could be caused by a rare or less commonly thought of genetic disorder like alpha-1.
In the COPD population, the frequency of having one mutation is up to 10%, meaning that if you test every 10th patient would really give you a positive result.
The problem we have with AAT deficiency is that it might be confused with other diseases. In fact, we know that the majority of patients with alpha-1 disease are associated with COPD. But that's not the only case. We also have cases reported of an association with severe asthma and also with bronchiectasis. So probably the majority of chronic airway disease could potentially be associated with this deficiency. And all the doctors should have it in their minds so that they can suspect it and diagnose it.
Alpha-1 is a rare disease, but is much more prevalent than we used to think.
As far as alpha-1 antitrypsin goes, we started with just one, my patient Brian, and now I take care of over 150 of these patients in private practice.